you take a step back sometime and listen to the messaging coming to you from healthcare providers and health insurance carriers, you're going to hear two terms over and over and over again: low cost and high quality. As a student of this industry, I kind of have a fun exercise I like to perform whenever I hear someone talk about high quality. I ask them what their definition of quality is. And every time I ask that question, it seems I get a different answer. The good news for health plan sponsors and plan participants is there are great tools that can be added into a self-funded health plan to truly help employers cut through all the noise and identify who the highest quality providers are based upon objective data, and help their plan participants then seek care from those providers to get the best possible outcomes. The best possible database that we have identified to identify quality is the Medicare claims database. If you're a healthcare provider that takes 1 penny in payment for Medicare, you have to report the number of times you provided a particular procedure and what the outcomes and complications were. One of the most effective indicators of quality is simply how many times a provider's performed a particular procedure. I'll give you an example. One of the more common elective procedures in the country is hysterectomies, happening over 600,000 times a year. This is generally performed by an OBGYN, and there's over 23,000 OBGYNs in the United States. If we just do simple math and divide 600,000 by 23,000, then we see that the vast majority of OBGYNs perform this particular procedure less than twice a month. And so when we are working to help people identify who the highest quality providers are they can see for a particular procedure, we want to seek those that do this all day, every day, that have great outcomes that we can validate, and that's where we want folks to go to seek the highest quality care. The downside for the average consumer is that the Medicare database is really hard to make heads or tails out of, and that's where a number of entrepreneurs have taken that data and put it into an easy to digest and understand tool that can be integrated into a health plan to make folks make informed health decisions. One of the most effective tools that we've identified is a tool called Quantros, which takes Medicare data and normalizes it based upon the types of patients that providers are seeing so that we can truly compare apples to apples. Quantros is a tool that's integrated into Sage Transparency, something we've talked about in this setting before, and it is something that's available to the average Joe just by going to the Sage Transparency website. So much in healthcare happens by luck. If I start seeing one particular primary care physician, they may have incentives to refer me within the health system that they're affiliated with. And we believe that a health insurance plan is the perfect tool to help head something off the pass and redirect a member to a higher quality provider if it becomes clear they're going down the wrong path. Traditional health insurance plans won't do this for various reasons, but the total control health plans that we build provide this information to employees simply on a voluntary basis. We want to educate them and help them understand what path that we see them going on based upon objective data and what a better path might be. As a student of the healthcare and health insurance industry, I truly want to find what are the actual facts that we can make informed decisions based on. And what I find in 2023 is that everyone says they're high quality and low cost. The reality is, though, that we know health insurance and healthcare is not affordable and not always low cost, and that bad things do happen when people interact with the healthcare system. So both things can't be true. So what we're all about is committing to find the true definition of quality and putting those tools in place that will help employers and their plan participants make the best informed decisions possible.